I'm Mark Goldberg. I write the UN and Global Affairs blog UN Dispatch. And I'm joined right now by Martha Newsome of World Vision. Welcome, Martha.
Thanks, Mark.
So what is World Vision doing at an mHealth summit?
Yeah, it would seem a bit odd. World Vision is a large Christian child-focused not-for-profit organization. We work in almost 100 countries around the world. And we got into the mHealth space basically because of our focus on children and our focus on communities, and also being a large organization that's struggling with our own information system. So we started to think, well, if we're developing a worldwide global system and we work in 100 countries, how can that system talk to government systems? And so that's really the genesis of how we got involved. I think there's tons of innovation. It's really about how can we take that from just project level innovation or point of care innovation to something that's scalable. So I think that's where it gets really interesting.
Okay.
So our concern is the frontline worker and the fact that most of the vulnerable populations that we work with, children and their families, often don't have access to facilities. And so how can we equip community health workers to provide better care for them, as well as for that community health worker to be able to link to better quality care at the facility.
What's out there that works right now?
Well, I think there's a really interesting collaboration that's forming between Gates, the Grameen Bank, Motec, Dimagi with their ComCare solution, which basically puts together a comprehensive maternal and child health platform, which would allow the community health worker to monitor the information that they're collecting and the clients that they have, as well as make better referrals to the facility, and also help them to follow standards of care. So using the World Health Organization standards, giving them protocols to follow that help remind them to do certain things, help remind them to know when to refer children to the clinic, and those kinds of things. So I think that package has got a lot of promise.